Can traditional Chinese medicine treat cancer? Perhaps almost every practitioner of TCM working overseas has been asked this question. Can TCM really treat cancer? We can't say a definitive yes to this question. Because as a matter of cause and effect, there is an organization called the ASA, which stands for Advertising Standards Authority. In Chinese, it's called the Advertising Regulatory Bureau. The Advertising Standards Authority. They have a strict and specific requirement that not only traditional Chinese medicine, but indeed all alternative medicines are not allowed to claim that they can treat cancer. So, if we were to say that we can treat cancer, we would be violating the Advertising Standards Authority's official regulations. This is certainly not a simple matter at all. When we are asked to answer this kind of question with a yes or no, we can explain that while we can't treat the condition, we can certainly help and we can manage it. This is why we usually prefer to use the terms cancer management or cancer care. This timely help can greatly influence the patient's overall prognosis. But what exactly does prognosis mean? In simple terms, it is a medical outlook about the balance between life and death. A good prognosis means survival. A poor prognosis means death. In many cases, with the intervention of our traditional Chinese medicine, the patient ends up with a good prognosis. Without our intervention, the prognosis is not good. So can we treat or not? The help we provide is absolutely vital, or it is of the highest importance. We can truly have a very significant impact on the patient's overall prognosis. The Technical University of Munich, located in Germany, published a research article back in 2020, which was originally written in the German language. It was about lung adenocarcinoma. One group received only chemotherapy, specifically cisplatin and similar chemotherapy drugs for lung cancer. That was one group of patients. The other group received chemotherapy combined with traditional Chinese medicine. So traditional Chinese medicine plus chemotherapy, that was the second group of patients, these two types. So what were the results? They observed the 12-month survival rate. So with chemotherapy alone, the survival rate was only 27%, because all the cases included in the statistics were stage 4 lung adenocarcinoma, which means late stage, 27%. A year later, for the group receiving TCM plus chemotherapy, the survival rate reached 78%, a significant difference.